Hello and welcome to the Postural Dojo podcast. My name is Sam Miller. I'll be your host on this journey of postural transformation, sharing some stories and insights from my own healing journey of a very severe 85-degree kyphosis scoliosis and speaking with other experts from a variety of fields, some that you might expect and some that might be a bit more surprising. Today, I'm excited to have Dr. Laura on the podcast. We're going to be having an interesting conversation because I think she is a expert in scoliosis and the posture in the body, but has also is experiencing some extra curves in her spine as well. So I've found that speaking with people who are dealing with the situation internally as well as with other people always takes us into a very special place. So I'm looking forward to it. Dr. Laura, please let us know how you ended up doing what you're doing.
Yes. Okay. I am Dr. Laura Glazebrook. I'm a physical therapist. I have been a physical therapist. I graduated with my doctorate in 2012. So I've been a PT for quite a while. But the interesting thing in my story is I also have relatively severe scoliosis, and I had a spinal fusion when I was 11. They fused my spine from like kind of thoracic, so T4 to L2, so that's the vast majority of my spine. But even though they did that, there still is a lot of I still have a lot of asymmetry in my spine. Like my right side of my upper back still sticks out quite a bit more than the lower. So I still have some visible, I guess, deformity is what they tend to call it. I just like to call it my curvy spine. But despite having that whole journey, no one really taught me much about my back. Here in the States where I live, they did the fusion. And then after a year follow up, there was no information at all to be had for this is what scoliosis might look like for you. These are the things that you need to think about, some things that are important for you. So the main things that I was told were, okay, well, avoid wooden roller coasters, which I found out why, very painful, and avoid a couple of other things, and then off you go. And so I had some PT when I was in the hospital after my spinal fusion, and I thought that was kind of a cool job. So that was back a long time before I even went to college. But from there, I did my undergraduate studies and then I did my graduate studies. I learned all about PT, but didn't really learn much about scoliosis specifically and scoliosis PT until about 3 years ago. I've aspired to keep a really active life. I grew up as a dancer, I was in musical theater, I taught group exercise in PT school, and I try to be very active as an adult. And my goal is to teach people that have scoliosis or kyphosis or spinal fusion or things like that, how to live their lives best with the condition that they have.
Amazing. We're on similar missions in that respect. You've touched on a lot of things that I kind of want to dive into. I guess let's start when you were 11 and you were diagnosed with an extra curvy spine. What was, as we go back 10, 20 years, it's very different. Let's say the conventional medical approach was very different to it is today. It is becoming a bit more psychosomatic, as in they're integrating a bit more of the psychological factors, a bit more of a holistic approach to it. But back then, it was approached very physically. There's a curve in the spine, and let's either do bracing or surgery to address that physically. And then once you've gone through the spine, there was, or there still is, I think, for the most part, a severe lack of guidance and kind of steps to rehabilitate, which is a extremely disruptive type of modification to your whole structure. So how, I guess, did you have one surgery at 11 and then you had follow-ups because the spine is obviously still in development? How did that play out? And then what was your experience going through this?
That is an excellent question. There are a lot of unknowns about my parents have no records they have no x-rays. They don't even have my surgical report. And I don't fault them for that. I think that is at least the system here in the US. Even still to this day, sometimes you have to ask your medical providers for records. So The only thing that I know is that when I went into surgery, the last x-ray that I had before surgery, my spine was at a 57-degree curve. So, in case anyone is unfamiliar, like a spine without scoliosis has zero, like that's a zero, or less than 10 is
0 to 10,
considered
yeah.
normal.
Hmm.
Right. And then over 10 is scoliosis. And the current guidelines is anything over 46 degrees is considered surgical. I know that I had a 56-degree curve, or sorry, 57-degree curve. And when I came out of surgery, they corrected it to the best of their ability. The resources that they had, I have Harrington rods, which those turned out to be not quite as effective as the newer methods. But they got me down to about a 35-degree angle, so better. But of course, I was still growing. And I don't have a lot of, there are no x rays for me to look at for what my spine looked like after that. By the time I thought to look for them, I don't believe there are any in existence anymore, because I think here in the US, we have it's a 10 years that they are required to keep medical records like x-rays, and then they're disposed of. So even by the time I thought to go back and look, I don't believe there are any in existence. So I don't know. But my theory is that they fused me in a up and down position, and I do have some kyphosis still on the side of my curve. But instead of curving more outward, I think my body just rotated more. So I do have a significant amount of rotation in my body. So when I bend forward, I have a larger the rib hump on the right hand side. But truthfully, and to my great frustration, I have no idea what I looked like right after surgery, and then certainly as I kept growing, because I foreseeably grew until probably age 14 or 15, or I actually don't know.
Okay, so it was the original Harrington rod surgery, which is essentially putting scaffolding on various vertebrae. And are they fixed length? Because now they have some extendable rods. But did you have to update and modify those rods as you grew?
The rods that got put in for me were just fixed. They do have rods now that grow, but I think that technology was not available at the time when I needed the surgery. They had they had fixed points where everything was attached. And now I think the rods that they have that grow, they will use like magnets, basically, is one of the things that I've heard, or they can do a surgery to go in and fix. But no, what I have is definitely completely fixed. I've got certain fusion on certain segments.
Okay, so I went in, I avoided going in. My mother and I were kind of on that journey. And you did speak to, you do need to become the voice for yourself. It's the medical system, a lot of the time, just by the nature of it, kind of puts them in a power position. And we're kind of like just being told what to do by the system. I think I'm a big advocate of kind of stepping up and taking that power into your hands and having that kind of leadership in your own health, because you are going to be your biggest advocate in the end. I I guess at that time I was 16, and there was obviously quite a very severe curve forming. We tried alternative things that really wasn't as well developed, or the alternative options were still very woo. Things like the Schroth breathing was barely known about, all the way from the orthopedic surgeon who would have been in a position to really set me on a good path to like different types of breath workers and body workers. So I ended up at 18 with a very severe diagnosis, 85 degrees, which should be surgical. But because my curve had already kind of baked in, I'd been through a lot of aches and pains as that kind of happened, but I was still living enough. I was still playing soccer. I was still active. And so I was not a candidate for surgery. And at that point, I'm like, all right, I've got to, it kind of hit me like a ton of bricks that I've got to live with this. And because I wasn't really empowered by him to search other solutions, or there wasn't really one that was like the obvious choice, I didn't kind of, I was aware of it, but for the most part, I tried ignoring it until I had to deal with the consequences down the road. So I'm curious now, what was the what was the rehabilitation process for you at that time? And did it include things like breath and mobility and fascia? And what does it look like now? And what kind of, yeah, what kind of protocol do you suggest for someone who's been through that type of surgery?
I am so glad that you asked. The rehab protocol that I remember was no rehab. And unfortunately, I do feel like depending on where you are, and I can only speak to what I see here in the US, but for the most part, many of these surgical centers that do these types of surgeries, they don't necessarily have a great post-surgery recovery program. For myself, what I remember, and granted, I will be 38 this year, so I don't remember quite so well back to 11. I do remember the vast majority of what I got from like a rehabilitation standpoint was I got physical therapy within the hospital to get me out of bed, to take me basically walking, to go up and down stairs. And I did a couple of sessions, maybe just one or two, not very many, of just traditional PT, like after my surgery. These days, now that there are more options, so I got trained as a Schroth therapist or a scoliosis specific therapist. If I can meet with someone before they even go into surgery, I love to do almost like we call it prehab. Like surgery is a big deal, and our muscles can actually be, we can prepare ourselves in a way by training the right muscles, which can make our recovery from surgery easier. In an ideal situation, if I can get to someone before surgery and I can train them on these are ways to activate your core muscles that can serve you for right after surgery. Here are some strategies to help you get in and out of bed. Here are some ways to start working on expanding your rib cage because you have this surgical, you have this fusion or some hardware in now, but your body still thinks that you have the scoliosis. So to start kind of training those things ahead of time can be really powerful for people. But that's in an ideal world, which we don't live in an ideal world.
Yeah, it's such a massive decision to make at a point in our lives when we may not understand all of these terms, we may not understand the consequences, we may not understand so much of the situation, but yet having to decide, should we do surgery or not? And that's a giant thing to consider. Um, because some, depending on the surgeon, there's some personal opinion there, depending on the person about whether how important that those aesthetics are, right? That kind of that question of how important is the aesthetic to the function as well. Because I had my at that time, I had to accept that I've got a really noticeable kind of posture and hump that's caused by that 85-degree curve with a hemivertebrae in the T10, which is basically a wedge-shaped vertebrae. So, but at the same time, I was functional. I was playing active sports and doing everything that I wanted to do. And to have to consider doing a surgery which would give me aesthetic improvement, but potentially limit my function, I had to kind of process and think through that. I'm curious, how do you think through that if someone's kind of facing that decision? Is the aesthetic worth it?
Ah, that is another great question. I think it is very nuanced. I do believe a lot of people when they go into the surgery, I think we are at an advantage now. So maybe something that you and I didn't have is there is the internet. There are some great resources available for people to get a second opinion. It actually turns out that for the majority of people, it depends on numbers. So if you look at the scoliosis recommendations, currently the international recommendations are when you hit a certain degree, you should have a surgery. But for the most part, it's true. So if you're looking at having surgery for aesthetic reasons, it's very important to take into consideration exactly what you're talking about, that there is going to be a recovery time. And if you're younger, it's a smaller recovery time. But if you're older, depending on how old you are, it could be a longer recovery time. Certainly if you are an older adult, 50s, 60s plus, it's going to be a whole other different thing. So I think one of the big things that I've worked with myself as somebody that has a very asymmetrical posture and tends to, I mean, I've struggled with body image issues my whole life. I think there is something to be said for trying to figure out some self acceptance, whatever that looks like. And so I usually challenge people to just keep those things in mind, that, of course, everybody's journey is their own. And certainly, if you really want to have a surgery and you really want to get that correction, then that's absolutely your decision and your choice. But to go into it from an informed place, knowing that there are considerations and there will be a recovery time, And you might not get quite as much aesthetic correction as you're hoping for. You might not end up with that straight spine anyway. But it's everybody's job to figure that out for themselves, right?
Yeah, it is. And it's a, if you can tap into that self acceptance, if you can tap into accepting the situation, and even better, even potentially becoming grateful of that situation for the strength that will it will build in your mind, in your character, things, you start to enjoy the process more, you start doing more of the work that is required to improve the situation. The Our greatest weakness can become our greatest strength, and that's, I know that in my body, in my experience, and it seems like you've been on a path as well, because you've now become, you're now on a journey helping others, and I think in a lot of ways giving the information that you wish you had in a lot of ways.
Absolutely. I think it's so awesome to see. It's just like a body diversity thing too. I'm hoping that as a society we are coming to appreciate the fact that differently bodies that look different don't there's no inherent difference in somebody could have a much smaller body. Somebody could have a much bigger body. Somebody can have some skeletal differences like a kyphosis or a big scoliosis and still be able to do pretty cool stuff. Like I go to the gym, I deadlift a lot of weight. I'm sure there's certain things that you can do that maybe somebody would look at your x-ray and say, oh, I don't think that this person can do that. But like that anatomy, it informs what we do, but it certainly doesn't dictate what we can and can't do. And I think so much of that part is mental. Like it's in your head for the vast majority of us. We have to prepare our bodies for whatever we want them to do just with those considerations in mind.
There's a lot of pressure to be perfect and look perfect, which, in my situation, I guess I was released from in a lot of ways really early on, because I knew that I could never look perfect. And that thought, at first I'm like, okay, I can't look perfect, I'm just going to live with it, and I'm just more about function. I'm just going to be functional and go from there. But more as my kind of techniques and approach develops, I have found like some of these bodybuilding poses and that activation of the musculoskeletal structure and building that aesthetic posture has a lot of value. And so I've gone a 360 on that one, and have integrated a lot more aesthetic. And it's not about achieving perfection, but it's about achieving my highest ideal, whatever that is, irregardless of everyone else's. It's my own process of creating a body and a feeling that I'm proud of, and it feels good and looks good, right? Whatever that may be for me.
Yeah, absolutely. I think that is I try to remind, I mean, myself certainly, and the people that I work with, and my community of the fellow curvy and fused people that follow me on Instagram. It's everybody's got something going on. And even if someone has a perfectly straight, in air quotes, if they have a perfect spine, or if they probably have other things going on too. And we all have to learn to love and use the body that we were given. And I think that the sooner we are able to accept and love that about ourselves, the sooner we can achieve that highest potential. It's just a matter of accepting where you are and loving yourself the way that you are instead of the way that you wish you were, or the way that maybe society thinks that you should be. It's about kind of radical self-acceptance and learning how to reach your goals in the way that suits you.
And the way we reach those goals, if that's the way we are, if the way we are is reaching those goals, that's inspirational. If you've been presented with a challenge, and you are someone who overcomes those challenges, who integrates those challenges, who accepts those, who loves yourself, who does that work, that's inspirational, and that is who you are. And that is also something to that will allow you to enjoy that journey. And when you enjoy things, you do them more and you learn better as well. So it becomes
Yeah,
a virtuous cycle.
for sure. I've seen people with very, again, if you look at someone's x ray or you look at someone's posture, you can make assumptions, but I bet you could probably outlift a bunch of people in your gym. Or there's certain things that I train my body to do. I've done triathlons, I've done half marathons. And just because someone has a certain, just because you have something going on does not mean that you can't achieve that highest potential if you work towards it.
Absolutely. Absolutely. And the benchmarks, I choose different benchmarks to get through, and they take me longer to get there. Even just to get a wall handstand, to get a muscle pull up, these things have and are taking me years. These are things that to iron out things that are getting in the way of my mobility, to do it, to get the right activation. These are multi-year journeys to go on, but I'm enjoying that process because as I get closer and closer, I'm healing, I'm building a new self. It's an amazing and journey to be on, and I'm grateful for that. And this is, yeah, now I'm in this phase where I've seen so much benefit in my own life. I'm now kind of packaging it and communicating it in a way so people at this really young age, where anatomy is just, and every kind of system that's involved, it can get really complex. So because I didn't do surgery, my approach and my methods are, I feel like I don't have hardware which might be obstructing or getting in the way in certain movements. So when people come to me who have had surgery, I'm a bit more reluctant to help them and would be likely to refer them to someone else who has experience dealing with that hardware in the body, because the braces, the physical bracing that I have is from my brain and nervous system and up through the muscles and the tendons and the fascia. And so the releasing of that is allowed to happen. But if there's hardware there, that it's an extra complication. How do you approach that? What are you kind of considering, or what are you careful of when it comes to that hardware that I wouldn't have experience in terms of rehabilitating with the hardware? What's the difference?
So I think I would say there's actually not that much of a difference because the hardware, yes, the hardware is doing part of the work of holding you up a little bit. So I actually just recently did an Instagram live on this very topic with a fellow scoliosis PT and strength coach, and we talked a little bit about it. The thing that the one thing that definitely changes when you have a fusion or some kind of hardware put in is you no longer have, there's this thing, segmental control. I don't know if that's a word that you're familiar with, but the control of those little tiny muscles between your spinal segments. I mean, our spine, if you look at just the anatomy of it, it is a very amazing, intricately supported system. It's a structure that's very well supported by musculature. It is very yes, there it is. Isn't it beautiful? It's just so beautiful. And it's inherently, regardless of if you have a scoliosis or a kyphosis or not, it is built to be strong and stable. And I feel like the worst thing that can happen is anytime we get into our heads and think that it is not. And even if we have a scoliosis, even if we have a kyphosis, the second we stop feeling like our spine is stable, the more trouble we get into. But back to your question about the fusion. So when we have a fusion and we have multiple segments of fusion, it just limits some of those like those little muscles in between all of the segments, and it changes how our muscles activate a little bit. But for the most part, so that person, they may have lost the ability to do some segmental, some like roll downs, just certain types of movement. They may be more limited, but I would say that they have all of the same strength considerations that anyone without a fusion has. So
Interesting.
really
So
the
it's a bit
approach,
more of that specific kind of, so those parts have atrophied or gone to sleep.
yeah, atrophy is probably a good word for it, just because those muscles don't get use anymore because there's a fusion there. So, to a certain extent, for some motions, they literally can't access those muscles. However, so the hardware is doing some of that, but I'm a huge fan of any type of stabilization. So, I mean, a lot of the things that you would typically do for a strength routine. I'm a big fan of all kinds of squats, deadlifts, and instead of sit ups and crunches, maybe replace that with a plank, just because again you lose some of that segmental, the ability to control each individual segment, so that can be really tricky for people. But for the most part, once someone has initially healed from that fusion surgery, I don't try to put any limitations on them whatsoever, other than just give them adaptations for certain exercises that they may need help with, because I feel like similar to what I just said, the second they start feeling like their spine isn't strong and stable, it just sets us up to this whole fear cycle where we stop moving and then our bodies get weaker and then it becomes this whole cycle, and that is where we really get into trouble.
Yeah, so I think pretty early on, because I had this severe compromise in my structure, I had braced and I held, and so I created like this compensated structure of strength in my body. And with certain twists, I knew that I shouldn't be doing certain twists. I knew I shouldn't be doing certain things. So I didn't really explore and go into those areas. And I lost a lot of my correct or more functional muscular strength atrophied. And so the rehabilitation process has been waking those up in a lot of ways. I, I wanted to take this into a place, but I mean, waking up those parts, how do you were saying you do some squats. Are you doing bar squats? Are you loading the spine sometimes?
Yep. Yep.
Okay. All right. That's not something I guess when had that compensated form of strength, I was doing bar squats because I'm like, I have that strength, but I wasn't activating those that I'd say, let's say more of a healthier, functional, optimal kind of chain of muscles to do the lift.
So yes, what I will say, there's a certain amount of coaching whenever somebody, even without a surgery, somebody with a scoliosis where they have asymmetry or a kyphosis where they have some muscles that may be overworking and some muscles that may be overly lengthened. I do try to teach them some postural correction before we ever start to do any weighted type exercises. However, I mean, I have the same corrections, like the Schroff type corrections, where I correct my spine to the best of my ability. I will do those before I pick up my weighted barbell. I will do those before I do whatever postural, whatever kind of strength exercise that I'm doing, knowing that holding myself in my most aligned position is going to just keep my muscles working at their best. And I definitely, for all the reasons, I want to make sure that I am loading those joints and I'm loading that spine because bone density is a very big concern for those of us with scoliosis and kyphosis. And the more we keep our bones and our muscles strong, the less chance we have of things getting worse as we get older. So I would much rather do the work now than have to worry about the quality of my spine bones later.
Right. It's through that resistance that we build the strength. And you've reminded me where I was kind of going with that compensated strength, because as I was not going into those areas, I had a, let's say this, it was like a fear of going into those areas, or a lack of trust, a lack of stability in those areas, because I'm going into a severe weakness in my posture. And it's that that not going into that area and allowing that kind of that fear in there for a very long time, for a chronic amount of time, that create a lot of things that I'm working out. And so now the rehabilitation process for me in those areas is going in and re-educating them and re-educating trust, and starting from those extremely basic positions, those things where you have to completely drop your ego and step aside from any personal bests or any competitive structure at all, and go truly back to, starting like those baby positions. As we start learning and using our bodies, we're lying on our backs, and we've got our feet in the air and we're rolling side to side. Then maybe we're crawling, all of these basic functions that we may not have explored, but certainly need to. So I guess I think we started jumping into the rehab. Like, how do you approach? So it seems like whether surgery or not, you have a similar approach for someone who's dealing with extra curves. How would you kind of like summarize in terms of, are you doing myofascial work? Are you doing breath work? Are you doing, give us the big picture of how you approach rehab in 2024, extra curvy spines.
I, I love it. I must admit, I think that the thing that I've learned in working with this community for the years that I have is that every kind of trainer, every therapist has a slightly different approach. And my approach is colored or shaped by the experiences that I've had so far. when I started as a therapist, as like a new grad, as a new physical therapist, I worked a lot with neurological injuries. So I did a lot of what we call neuro, like just kind of facilitative movements for teaching like the brain and the muscles to kind of work together a little bit better. So it was a very like, neurologically based approach. And then I transitioned into pelvic health. So I spent a lot of time thinking about and getting to know the fascial system. So how scars can be restricting for our fascial system, how that core support needs to support us during all kinds of movements, whether that's as simple as getting in and out of a chair or lifting a heavy weight or climbing up a rock wall or whatever that is for you. And then on top of all of that, then I started training in the scoliosis and the kyphosis based approach. So I think for me, where I normally start with is I love to start by educating somebody about their specific spine, their specific situation, and just giving them that empowering knowledge that actually their spine is stronger than they think it is. And actually, they are quite capable of doing X, Y, and Z, and know their spine is not going to crumble if they try this thing. And to empower them first is always where I start. So day one, when someone works with me, I have a whiteboard and I will draw on that whiteboard. This is what your spine looks like. These are the things that you need to know. This is what we're going to work on. And for me, before I even do a lot of fascial work, I actually start by teaching them some muscle activation. So I start training them, okay, here's where your kyphosis is, or here is where your scoliosis is. These are the things you need to do. These are the muscles you need to learn how to activate to pull those into their best position and to hold them there. And then from there, as we build that kind of motor pattern, as they start to learn where they should be, as they get stronger in that, then I can start to do some of that myofascial release and some different work like that. But a lot of times for me, I tend to go towards exercise and strengthening first and like brain retraining first. Because if I loosen something that's tight for a reason, that could cascade into other issues, right? If I loosen something too soon, it could lead them going more into a compensation, or it could lead them to having different pain in a different area. So I usually default to let's get those muscles working first, and then I can go in and do some of the myofascial stuff. But usually for me, it's all about learning proprioception. Where is your body in space? Do you know where your body is in space? How can we work on that? And then how can we strengthen those muscles to best support your ideal posture? And then move on from there.
Amazing. Yeah, you're, as I mentioned kind of in the beginning, when someone has approached this from a situation they have going on internally, I just notice a much more holistic approach of including these systems and these ideas that need to be considered to really kind of go at this. I'm curious before the myofascia, because yeah, myofascia is a great place to release the compensations, release things, but we also do need to be activating. So when you're activating in the beginning, which levers or which parts of your body are you like, okay, let's get these in order and aligned and activated as they should before we start removing the tensions and the fascial clustering that we might get that might be holding us back, literally.
Yes. So I love to think of it as a movement professional, as a healthcare professional. I like to think of myself kind of like a body mechanic. So I love to watch somebody move. I love to watch what they do when they get in and out of a chair or get on and off the floor. And for me, I look at, yes, I look at where they are. I look at if they have asymmetry, but as they move, I want to see where do they lose control. So for those of us with a scoliosis, usually it's on that part that's sunken in or that concave part. Or is your pelvis going one way? And you have to kind of figure out their tendencies. And the first thing that, I like to try to tell people is, or I'll just bring their attention to it. Hey, can you feel when you do this movement that you kind of fold a bit here? Or can you feel that hip shoots this one direction? Or you feel more weight in one leg? And sometimes even without over cueing, they can fix it themselves. The body is smart. The body can figure out how to do these fixes on their own. And if not, my job is to teach them how to use their musculature where it is to hold the body in its most optimal position and then strengthen there. Because one of my biases as somebody who is a PT and a strength advocate and somebody living with a fused and curvy spine, I am never going to believe somebody telling me I can't do something I want to do. My job is always going to be figure out how we can support someone to do the things they want to do. And if that answer is ever, oh, my PT told me not to do that thing, I'm more likely to be like, but can we safely? But can we?
Someone recently left a comment saying that they were recommended not to get pregnant because they have scoliosis.
Mm, yeah. I'm building a whole empire for that. That is a very common thing that people hear. It's incredibly common. In fact, actually, I get direct messages and I get people emailing my site every single day and saying that they had either a surgeon or a healthcare professional that maybe didn't know scoliosis or kyphosis as well, that just tell them it's probably best not to get pregnant. And honestly, as someone that I have a severe curve, I have a fusion. I've also had two successful pregnancies, two successful childbirths, and I for anyone who wants to have a family, that's a heartbreaking thing to hear. And again, my bias is if someone can get the help they need first and learn how to strengthen and prepare their body, for the vast majority of people, if they want to get pregnant, it should like it's perfectly safe, it's perfectly fine. There's a slight increased risk of pain, but for the vast majority of people, it's completely fine.
Yeah, you're dealing with weight in the body, and again, if there's a lack of awareness and ignorance, if there's just not a lack of understanding of what's going on, there's potential that it can get aggravated and continue. But like you were saying with the prehab, I imagine there's similar things that you can be doing to start getting ready for this kind of renegotiation of weight that you're dealing with, right? It is all of this negotiation with gravity that I like to refer to. And I imagine a giant weight on the front is going to change that negotiation.
Yes. So, what I will say is, I actually just last year I ran a webinar on like just overall scoliosis, spinal fusion, and pregnancy. What do you need to know? So, I dug headlong into the research and I looked at articles starting back from the 90s all the way up. I think the most recent one I found was in 2020. And really, it's the people that experienced, I mean, there is a slightly higher risk of pain for people. And it's just that you think of mechanically, if there's shearing or more pressure at certain joints, it makes sense. But also, there's a large percentage of women that do have low back pain in general with pregnancy, even without a scoliosis or a kyphosis. But really, there wasn't a huge risk of a curve even getting worse. And sometimes, if it did get a degree or two worse, it would oftentimes go back to where it was before. And so I think, again, it's that our bodies are incredibly resilient and our bodies will adapt to this, whatever the situation is, whether that's the increased weight of a baby or whatever the thing is. And it, we can adapt well. I think, again, sorry, the worst thing that we could do is tell somebody that they can't do it or put that fear into their brain, because the fear is the most paralyzing thing of all.
It is. It is. And let's take that a step deeper and something, especially because you have such an amazing kind of variety of experiences as well with your kind of neural focus earlier on. One of the research papers that has been really profound and really tangible in the healing that understanding this has brought me was originally hypothesized by Dr. Roth in 1969, and he called it asynchronous neuroosseous development. So basically, a disproportional development of the brain and the spine, the spinal column, the bones. So then there was further research in the late 2000s by some Chinese researchers, and they've identified with MRIs that in adolescent idiopathic scoliosis patients, there is a proportionally shorter spinal cord in relation to the spinal column, the vertebral bone around the spinal cord. So there's a shorter spinal cord, and that could also mean nerves contract and relax. That's really their range of motion, is contraction and relaxation. So they've identified that there's a contraction of the spinal cord happening in people with scoliosis. And when you have a drawstring in your waistband and you scrunch it tighter, you contract the waistband, you get a scrunching effect, which creates a warping exactly like a scoliosis or a kyphosis. So for me, it's one of the most profound kind of ways to look at this in our own bodies, because the consequences of understanding this is profound, because we're starting to realize that our spinal cord is an extension of our brain. So we have this brain which we can send signals and messages to our body, and our body will send signals back up through that same system. And if we are chronically, very frequently, in a state of fear, of which that fear might be in the form of freezing, it might be in the form of flight, activating the muscles to run, and as constantly we're just in a constant state of ready to move, or it might be a chronic state of anxiety or tension about the future, some future that we're trying to create or we're trying to resist, or perhaps there's some type of external physical or emotional trauma that might be putting us into that state of fear over long periods of time. And if those conditions are happening through those adolescent teenage years, when our spinal cord and our spinal column are spurting and growing, if there's a chronic state of tension in our spinal cord, it seems to me that's ground zero for where and how to look at some of these curves that are forming during those periods. And it's an area that I just don't hear talked about as much, because it is newer research and this thing can take decades to truly become common knowledge amongst orthopedic surgeons who would ideally know this and be able to kind of recommend a protocol that includes this holistic look of, okay, what's happening in our brain signals that are creating this contraction of the spinal cord potentially. And so in my own process, because this is something over the last year that I've really started kind of understanding and implementing deeper, as I've integrated more relaxation of the nervous system by thinking and breathing in ways which downregulate my nervous system in physical situations that elongate and align me physically, I feel alignment happening. I feel the vertebrae align. I feel the elongation happening. I feel my posture improve. I feel myself letting go of layers that I didn't even know I was holding on to. And I think, oh, great, I've let go. I'm loose. I'm good. Then I go deeper and slow the exhales. And I realize I have another layer that I can go in. And then I move into a certain position. I find out I have another layer that I can let go to. So this area for me is extremely important, profound, and I think useful for anyone on this journey. And I hope more people can understand this, because it's something we can all implement. It's free and it's extremely helpful. I'm curious, what's your perspective on that area of this?
Yes, I could talk for a million hours on a lot of my theories, but I do agree that the nervous system and tensions within the body certainly do impact us and on a day-to-day basis, and certainly holding chronic tensions and just holding the same worries and anxieties and tensions will shape you throughout your life. And for some people, that means think about that fetal position where we end up in more of a forward flexed kind of position. That definitely makes a difference. Certainly, there's something to be said too for if you're in that state, you're less likely to move your body. And when it comes to what we know about the body is motion is lotion, right? The more we move our bodies, the more flexibility we keep in those joints, in that rib cage, the more space that we have, that is life-giving. A lot of times people with older adults that have these chronic conditions like a kyphosis, like a scoliosis, or like chronic lung conditions, when they stop moving, it's like when you start to have restriction in that rib cage, that can start to look really scary for an older adult. You start to feel like it's harder to breathe. You start to feel like that anxiety and those things do build over time. And I have learned within my own journey about probably the past year as well, but I've started to really pay attention to getting how to calm my nervous system in a way that I can do daily in small spurts in my very busy, overbooked schedule. And just including daily stretch breaks, getting out into the sun, making sure you drink some water, being intentional about your movement, doing some breath work. And for me, that's also been really profound. And I actually, a lot of the people that I see, especially adults and those that a lot of people that come in have a lot more emotional and anxious thoughts that they verbalize to me. And those are the things that I'm telling them as well. Can you pull out, if you have a meditation app, can you try meditating? Can you try just doing some decompression of your spine? Can you lay with your legs up a wall? What can you do to start bring that tension down a little bit? Because I do think that it's healing to get rid of some of that tension, and holding it for years and years definitely it shows itself later in life as well. So it's always better to manage it when you're younger.
I held those types of tensions for 15 years in my body in a very deep core part of my structure, and I didn't even know they existed. I didn't, or I ignored from my awareness, from my attention. And those things, as I brought my awareness to them over the last 5 or 6 years, they take years to undo. And there are layers to this because you're dealing with sometimes the fascia, sometimes the nervous system, sometimes muscles, sometimes the whole structure that's really just been formed to compensate and hold these tensions that are going on. So it's a something to bring awareness to filter out, and yes, as you said, address as soon as possible. So where do you see scoliosis and kyphosis treatment going in the future? And what are you hopeful about the future of how medicine approaches this?
I am hopeful. I just this morning I was on Instagram doing a live with a friend of mine who wrote a book about scoliosis and fusion. And we were just talking about how we both feel like it's positive, it's progress, that it's becoming more of a multidisciplinary approach for people. At least here in the US, now there are some alternatives. There's scolio Pilates, there's yoga for scoliosis and kyphosis, there's Schroff, like PT for these spinal conditions. And I think there is more of a growing awareness of treating the whole person. So sometimes that looks like emotional therapy. Sometimes that looks like support groups. Sometimes that looks like just education and teaching people about their spine. I feel like the thing, at least that I hold in my past, that was really limiting as a kid was it was this diagnosis that was put on me. And no one knows what's going to happen. It was all wait and see. And then all of a sudden it was like, no, we need a surgery. And that feels very disempowering. And now looking back, I don't have any images to see what my spine looked like, either before surgery or right after surgery. And so I'm hoping that now for people in the future, that there's more possibility, there's more modalities, there's strengthening. I think there's also more, I would hope at least there's more acceptance for the fact that bodies can and should look different. And so I'm hoping that some of that kind of stigma is a strong word, but some of that heavy load that we carry being in a body that looks different than maybe our fellow neighbor, classmate, whatever. I think that can be really great too. But I'm hopeful that as we start to learn more about the body in general, and as we start to treat somebody's whole body and keep them strong and healthy and active throughout their life, I am hopeful that at least if somebody does get this diagnosis, they feel more supported and can have an active and healthy life, because that's what we all deserve. And that's what we should all strive for in the end.
When I went through the system, and I believe, now as well, you'll go from a general doctor who might notice a curve, and then you'll be sent to an orthopedic surgeon for analysis to see whether you need to get surgery or not. That's a common path for a lot of people. And unfortunately, the conversation that is happening in the orthopedic surgeon's office is he's deciding whether surgery or not. And that's why wait and see is the conversation. And then yes or no is the conversation. There's no in between. There's no, okay, there's a compromise in your posture. Let's start with the least invasive approach first. Let's address the whole body holistically, and let's address. For me, the posture is the mind, the body. It's the way that the soul expresses itself. It's everything, and it does require that approach. And there is so much that can be done before going to the surgeon's office. And I hope, and it sounds, it's people like you that are kind of that stepping stone that needs to be on this path to empower people to understand what's happening and to understand what can be done and what quality of life they can foster by these more holistic approaches. And I think a lot of the conventional medical system is it's going for solutions that don't require any work from the person. So that's why the pills and the surgeries are usually a thing. Just take the pill, just lie on the table, right? There's no work required in these solutions. And I think that's why, because they're looking for to get results in everyone, no matter how much work they do or not. How do you prepare someone for the work that they're going to have to show up and do?
Yes, I do want to speak to. I totally agree with you from the traditional medical system. I don't know that itself will ever truly change. I am hopeful in the scoliosis community that I've been in. I have the privilege of being able to attend like webinars and online learning where I do hear from surgeons who are very pro movement, who are very pro physical therapy and pro alternative approaches. I do think, at least here in my kind of metropolitan area, there's still a lot of pushback. And we know that with research, it takes between 7 to 10 years for what, so even if it's a fantastic research study and it's very sound, it takes 10, almost, or even over sometimes 10 years for it to be accepted into common practice. And I think part of that is, at least here in our medical system, doctors are overscheduled, overworked, and there's a little bit of that God complex, I suppose, where they just, what they know is best. So I think that from that end, there's not going to be.
They're also incentivized and paid to do a surgery.
And that's always going to be the thing. A surgeon is trained to cut, a surgeon wants to cut, they want to do the operation. But the thing that I'm hopeful about is that there's more available online and people are now being their own advocates and going out and looking for solutions. And there are things that are helpful, like social media, people with websites that are empowering that are available for people to access, I suppose. And that's what makes me hopeful.
So please share how you are working with people. Where can they find you online? Where can they find these communities that you're a part of?
I am most active on Instagram. I am at laura.g.dpt. I have a website that's my name. It's w.dr, dr, Laura, Laura, Glazebrook, glazebrook.com. I work with people virtually all the time. I have an evergreen webinar, the one that I mentioned about scoliosis and pregnancy and spinal fusion, that I have people that ask about every day and that it's been very helpful for people. I'm planning a couple of virtual offerings coming up. So if someone wants to get in touch with me, they can find me on Instagram or they can join my mailing list and keep up with all of the things that I am up to.
Amazing. Laura, thank you for sharing your perspective on all of this. I value your approach. I want to honor your mission that you're on by empowering people with what they can do and providing a alternative path for a lot of people that might be very confused and worried about what's coming next. I know you're dealing with a certain pregnancy and certain fusion people that I know that approach me that I would be more comfortable referring to you because that's an area that does have more specific knowledge and some more specific approaches to the hurdles that they're overcoming. So thank you very, very much for doing what you do and showing up to share it.
Thank you for having me on. It was fun.
Amazing. All right. Thanks for listening, everyone. We'll see you in the next one.